Julie, fantastic for you to come here at Abraaj Week. Tell me, Bill and Melinda Gates Foundation, you've done dramatic things at bottom of the pyramid across Africa and Asia. But as you know, disease burden is changing massively. Triple disease burden: road traffic accidents, communicable disease, chronic disease. How are you changing your approach to the foundation to deal with this?
Sure. So, Khawar, as you know, we're focused on the poorest populations in the poorest countries. So the burden of infectious disease, even though it's diminishing, is still pretty significant for those populations. But I think what the change in the disease burden and the shift towards the non-communicable diseases is doing is it's driving us to think about health systems and how can we strengthen health systems in these countries, because the only way that we're going to be effective in the our long-term goals is to actually think about it from a systems level. So
we couldn't agree with you more. As you know, the Sustainable Development Goals call for healthy lives for all by 2030. We believe health systems are critical to that. How do you believe health systems will be developed?
Yeah, it's a really tough thing. We work in a lot of different markets. We work in agriculture, we work in education. And the thing that I've learned is that health systems are incredibly complicated, and there's no one answer. I'm a big fan of market-based solutions in the private sector as key stakeholders and key actors in terms of solving the world's problems. But the private sector alone cannot create the health systems. You actually have to think about it in terms of partnerships between the private and the public sectors. Let me give you an example of that. We actually, a couple years ago, did a landscape of new businesses and businesses in India and Africa that were focused on the bottom of the pyramid populations, on the poorest populations. And our hope was that we could invest in funds, or we could invest directly into some of the most promising business models that were focused very much on those poorest populations. We surveyed like 800 companies and then identified those most promising companies. And the challenge with them is that they were either weakly profitable or not profitable, and they were subscale. And why was that? These are great inspirational entrepreneurs and leaders, but the problem is that the very poor cannot on their own afford to pay for healthcare. They cannot afford to pay for quality healthcare. And so a private sector solution is not going to reach down to the very poorest, the bottom of the pyramid populations. And the only way that we are really going to get healthy populations is if there's some degree of public subsidy, whether it's government insurance or whether it's donors. And so we have to think about it in terms of public-private partnerships, bringing the efficiency, bringing the scale delivery potential of the private sector together with public funding for the poorest populations. And that's what we're excited about seeing, and that's what we're excited about the Abraaj Fund and its ability to deliver those types of partnerships.
Well, as you know, that's exactly the way we think. This is all in partnership with people like yourselves, with governments, with strategic partners, with local investors, local entrepreneurs. As you look forward to the next 5 years, either in sub-Saharan Africa or South Asia, what would you see as measures of success along those lines of partnership capital deployment? How would you measure impact and success for the foundation?
Yeah, we think about success and we think about impact in pretty simple terms. So we have one specific measure that we think about, which is DALYs, or disability adjusted life years. And we think, we want to see those metrics, those very basic metrics change. But I think the thing, when we think about systems change and we think about developing very functional health systems in these markets, I think what we'd like to see in the next 5 years is some real exemplars of really strongly functional systems. And so that's, again, where we're excited by the Abraaj Health Fund and the ability to go and build private health systems at scale, delivering affordable, high-quality healthcare. So if you can develop exemplars of very efficient private sector institutions, we think that there's going to be a ripple effect in that it's going to raise the standards for local clinics and local institutions. It's also going to raise the standards for the public health system. And so, if I look 5 years forward to see what we want to see, I would love to see some just great institutions out there delivering high-quality healthcare at scale.
Yeah, we totally agree with you. And indeed, to your point, we hope not only do we create them, but we catalyze a whole sector that raises the bar for everybody. Yeah. Thanks for coming, Julie.
Absolutely. It's a pleasure to be here.